Hello, welcome to Library Connection. I'm Mandy Cantrell, Youth Services Director at the B.B. Comer Memorial Library here in Sylacauga. Before I get started with the program, I'd like to thank TV47 for all they do to help us put on our program. Today, I'm talking about something that I know we all have heard about and we know about, and there's always more to learn about it. We're talking about COVID-19, and Jeff Wood is joining me from Coosa Valley Medical Center. You are the infection preventionist.
Yes, ma'am, that's correct.
I got that right. Good, good. Well, just tell us what your job is at CVMC as an infection preventionist.
Okay, so as an infection preventionist, my job before the pandemic and even during the pandemic is to make sure that when you come into the hospital that you don't leave with an infection. Hospital-acquired infections are very important, and we want to prevent all of those that we can, and I put processes into place that help reduce the risk of you getting infection. A couple of things that we look at are catheter-associated urinary tract infections, and so when you come into the hospital and you get a catheter in your bladder, we want to make sure that each and every day that you need that catheter. So we evaluate the need for that, and we try to get those out just as soon as possible.
Good.
Another big thing that I do is hand hygiene. I love hand hygiene because it's probably one of the most important things that we do at Coosa Valley to prevent infections. So I want to make sure that everyone's washing their hands correctly.
That seems so simple, but it's so important.
It does seem simple, and it really is simple. I mean, it's a 15 to 20 seconds can prevent a $20,000 infection. So your return on investment there is pretty great. So we really push for hand hygiene.
Well, thank you for being here, and thank you for all you do at the hospital. Well, we are talking about COVID-19, the coronavirus again, and I know we've talked about it a lot, but just kind of explain basically what that is.
So the COVID-19 is a coronavirus, and one thing to remember is this is a new virus. It's called a novel virus, and that means new. So scientists have never seen this particular virus in the human population. And so back in 2020, we started seeing infections, and it has produced severe respiratory problems. And, you know, it just spread. It's a pandemic, so that means it has spread across the world. Every country is affected, every continent is affected. So that's what we're dealing with COVID-19.
This is the first time in my lifetime that I remember this happening. So it's been, it's kind of hit us all pretty hard, I think.
That's right, that's right. I guess the last pandemic was the 1918 Spanish flu.
Okay.
We did have a SARS outbreak several years ago, and there's been some influenza outbreaks as well that were pretty severe, but nothing compared to what we're currently in with this pandemic. Right.
Well, what can we do to prevent COVID?
So
besides hand washing, which is a big thing.
Hand washing is great, and I will say, you know, one thing, I'm kind of an optimist, so the good things that I see are all the hand hygiene stations that are coming up. So I see hand hygiene stations in gas stations, in places of business, in churches, everywhere people have hand hygiene, alcohol foam, hand sanitizer. Those are really one of the pluses, because not only is it going to prevent coronavirus, but it's also going to prevent flu and common colds and other diseases. So your hand hygiene is very important. The second thing to do is 6 feet distancing. So as much as you can, separate yourself from people that are not in your home. Maintain that 6 foot distance. And all of these things, what they're going to do is reduce your risk of contracting the coronavirus. You know, I don't think anything is 100%, but certainly whatever we can do to reduce that risk is what we want to do. So hand hygiene, social distancing, 6 feet apart, and then the mask use. Our mask use is still extremely important because it prevents me from transmitting the coronavirus. So if I have it in my nasal passages or in my oral cavity, if I have that mask on, it prevents me from passing that along to you. And then if you have it and I have my mask on, it's another barrier. It's another way to reduce that risk of transmitting that disease. And then the last thing is vaccines.
Yes.
We're lucky to have several vaccines on the market now. We have Pfizer, Moderna, and the Johnson & Johnson vaccine. So those are all, the vaccines are there to help prevent hospitalizations and help prevent death from occurring. And our current data shows that they are effective in doing those two things. And so we definitely encourage everyone to get out and to get their vaccine.
Right, right. It's very safe. I
Yes.
had mine. I know I felt a little bad after the second one, but just really for a few hours.
Yeah, yeah.
That was fine.
When I had mine December and January of December of 2020 and January 2021, they're 21 days apart.
Right.
I got the Pfizer vaccine, so you get a first dose of Pfizer, and then 21 days later you get a second dose of Pfizer. I had no problems. I had no fever, nothing, and then my entire family has been vaccinated, and no one had any kind of side effects. My wife Lisa, she actually got a burst of energy and ended up painting the house. So,
Hey, wow. Well, I did not get the urge to paint the house, but it was not a big deal.
Yeah,
Not a big
yeah,
deal.
yeah.
Can you still get those? I know, we got ours at the doctor's office. You can get them at the hospital, pharmacies. Is that all still available?
Yes, ma'am. Coosa Valley Medical Center. We offer the vaccine every Wednesday from 8:30 till about noon, and so you don't have to have an appointment.
Okay.
You can just go right into the lobby, and there'll be somebody there to show you where to register. And the whole process probably takes about 30 minutes.
Right.
So it's usually very easy to get in and out. The time. So we give the vaccine, and then we ask you to wait around for 15 minutes just to make sure you don't have a reaction. Some people we ask to stay 30 minutes because they may have some kind of pre-existing problem. Maybe they've had anaphylaxis in the past on certain drugs. And again, we just want people to be safe, and we ask them to hang around. But it's a very easy process. Very quick process, doesn't take long at all.
And it's free. Is
And
that
it's
correct?
free. There's no charge to you, so it's totally free, and we encourage everyone to get out and get that vaccine.
Great. We're going to pause for a commercial break, and we'll be right back and talk some more with Jeff Wood.
Uneven floors got you rolling? Ox Foundation Solutions has the expertise and the know-how to repair cracks, wet basements and crawl spaces, and uneven floors in your home. It's time to get strong. How strong? Ox Strong. Get a free estimate from Ox Foundations.
Marble City Pharmacy in Sylacauga is your destination for the highest quality health care. Our knowledgeable pharmacists are always available for questions about your medications or advice on taking over-the-counter products and supplements. Our friendly staff can assist you in choosing from our full lines of compression hose and medical equipment. And don't forget our gift department. We have a great selection of unique gifts for every occasion. Stop by and see us today. Marble City Pharmacy, here for life.
Coosa Valley Medical Center, one of the top 10 hospitals in Alabama, is also Sylacauga's largest employer. Services from the emergency room, to surgery, to cancer treatment, to post-stroke care. You won't believe what's right in your backyard. It's Coosa Valley Medical Center in Sylacauga. So, if you're sick in Alabama, choose one of the top 10 hospitals in Alabama. That is Coosa Valley Medical Center.
Welcome back to Library Connection. I'm talking with Jeff Wood, the infection preventionist at Coosa Valley Medical Center here in Sylacauga. And we're talking about COVID-19. Let's talk a little bit about the new variant. what's it called?
The Delta variant.
Delta variant.
Yes, ma'am.
And
yes, ma'am.
that's prevalent here, right?
Absolutely, absolutely. In fact, this morning, as of August the 12th, Coosa Valley Medical Center has 12 positive patients. 4 of those are in our ICU, 2 of those are on the ventilator, 8 of those are on our COVID floor. But here is the thing, all 12 are positive for the Delta variant. So we have the Delta here. That's what most people are getting. And what you see with this Delta variant is it's more contagious and the sickness is greater than the regular coronavirus. So, and what we do at Coosa Valley, so the question is, how do we determine that? So when you come into the emergency room or our inpatient setting, you have those COVID symptoms, you have fever, you have cough, you have aches and pains, chills, all of those things that we suspect that you have COVID, you'll get 2 swabs now. You'll get a swab for a rapid test, which will tell you if you have the COVID, yes or no. And then the second swab is what's called a PCR test, which we send to our lab in Memphis. And that lab will determine the variant of the coronavirus. And the reason we do that, 2 swabs, not very comfortable, and it's still very uncomfortable to get your nose swabbed. The reason we do that is because one of the things we pride ourselves on is efficient care. And we don't want to have to go and redo the swab once that it's positive. If we know it's positive and you are in our emergency department and get sent home, we can go ahead and send you home and tell you if you've got the variant, because it takes a little while for the variant to come back. So we do that so you don't have to wait so long in the emergency room to get that second swab done. So, but yeah, the variant is here, and it is rampant in our city, in Sylacauga and the surrounding areas.
Gosh. Well, I know we talked about the vaccine. Does it fight against this variant?
Yes. So far, the data suggests that it is effective against the Delta variant. And here's the thing about viruses. They will constantly be mutating. So the idea that this variant came up is not, totally shocking that it was there. We know that viruses mutate throughout, just like the influenza virus. Every year it kind of changes shape. At its core, it's still an influenza virus, but it's just a different set of proteins on the cell that causes it to change. Same thing with the coronavirus. Or with the COVID, at the core, it's still a coronavirus, but the different spikes on the cell membrane is what makes it the variant. And they have ways to name all that and things like that. So,
that's way over my head, but all I need to know is what you're saying. Just be careful. Now, I've had the vaccine. Do I still need to wear a mask? That's a big question.
So now the CDC guidelines are for people that are vaccinated, they do need to wear a mask in public and in large gatherings. And for example, so I've been fully vaccinated. Yesterday at church, I got a chance to be the door greeter, but I had my mask on. And the reason I had my mask on is just what I talked about later. I could have the Delta variant, the COVID, in my nose and in my mouth, and as people come by me and I say good morning to them, I could pass that along, because if you're holding a door for people, you're not really 6 feet apart. You're pretty close. And so I chose to wear my mask to just prevent that from being spread to other people, because at the end of the day, I'm concerned about passing it along to other people. That's what I don't want to do. Right. So I want to protect the people that I'm around in case I do have the coronavirus in my nose or mouth.
Because you can have COVID and not know it, right?
That's right. That's right. There are some asymptomatic people. Asymptomatic means you don't have symptoms, but you're carrying the coronavirus, the COVID, in your nose and mouth, and you can easily spread it. The Delta variant is highly contagious. It's much more contagious than the original COVID, and that's what makes it so really so bad, because it is so contagious. And like I said, that Delta, we're seeing the people in our hospital now are sicker than what they were 2 months ago.
Really?
We're seeing a lot more sicker people, and they seem to be sicker longer as well. So,
Okay. Now, when you say they're more sick, is that breathing, aches, pains, or
yes, most of it turns into respiratory symptoms. Probably more short of breath, require more oxygen, and that's typically what we're seeing. And higher fevers for longer periods of time.
Okay.
Now, we're still treating with remdesivir, which is one of the drugs that we treat with. We also use breathing treatments, and sometimes we include antibiotics if there's a component of pneumonia going on with the patient as well.
Now, I know it's possible to get the vaccine and still get COVID. I mean, I feel like no vaccine anywhere, anything, it's 100%.
Yeah, that's correct. So you're going to have breakthrough cases, even if you get the vaccine, but the point of the vaccine is you won't be as sick, and it prevents you from dying. And I think that's probably one of the reasons I chose to get the vaccine, because what I saw a man that was my age, extremely sick, and just on the ventilator. We had him 100% oxygen, so there's no more oxygen that we could give. He just would not get better, just would not. And typically you treat a respiratory infection, and it takes a long time to get better, but that man just did not get any better, and it really frightened me, to be honest with you. Because I have children, I have a family, and I'm not quite ready to go out.
No, I know what you mean. I want to do the same. I know friends who have been very sick, or know people that have died from it, and as I began to weigh whether I was going to take the vaccine or not, I thought, well, are the long-lasting effects of COVID seem to me were worse than the effects of the vaccine.
Absolutely,
So
absolutely.
Everybody I know has the freedom to make their own choice.
That's
but
right.
What ages can take the vaccine?
So for the Pfizer vaccine, which is what we give at Coosa Valley, 12 years and up can get the vaccine. I believe that there will be some lower age restrictions as new data comes available, but right now it's 12 and up. So with school starting in a couple of weeks, I think we all, and as a parent, I want my child to go back to school in person, and I think one of the safest ways to do that is to get our school-aged kids vaccinated. We were able to partner with the Sylacauga City Schools, Coosa Valley and the Sylacauga City Schools, and we provided vaccines at parent registration. And we got a really good response out of that. We saw an uptick on the amount of vaccines that we gave, so we're really pleased with the response of that. And I think a lot of times, I guess last year when this started, the band and the football team and all the sports related teams, so all of them they're around each other in very close proximity. So that's a good group to get vaccinated. We want to continue to have our football and our band program.
Yes.
So
it's not fall without high school football.
No, it's not. It's not. So I would encourage those students really to get vaccinated.
That was a good way to do it, though. A great way for y'all to partner together.
Yes, ma'am.
We're going to pause for another commercial break, and we'll be right back to talk some more with Jeff.
Uneven floors got you rolling? Ox Foundation Solutions has the expertise and the know-how to repair cracks, wet basements and crawl spaces, and uneven floors in your home. It's time to get strong. How strong? Ox Strong. Get a free estimate from Ox Foundations.
Marble City Pharmacy in Sylacauga is your destination for the highest quality health care. Our knowledgeable pharmacists are always available for questions about your medications or advice on taking over-the-counter products and supplements. Our friendly staff can assist you in choosing from our full lines of compression hose and medical equipment. And don't forget our gift department. We have a great selection of unique gifts for every occasion. Stop by and see us today. Marble City Pharmacy, here for life.
Coosa Valley Medical Center, one of the top 10 hospitals in Alabama, is also Sylacauga's largest employer. Services from the emergency room to surgery to cancer treatment to post-stroke care. You won't believe what's right in your backyard. It's Coosa Valley Medical Center in Sylacauga. So, if you're sick in Alabama, choose one of the top 10 hospitals in Alabama. That is Coosa Valley Medical Center.
Welcome back to Library Connection. I'm talking with Jeff Wood, the infection preventionist. I'm going to get that. Talking about COVID-19, and it has really ramped up again. I feel like it's been waves. It'll get really bad, then better, then bad, then better. Talk about that.
Yeah. So in June, we experienced a decrease. We went for about 4 to 5 weeks without a hospitalization, and things were really looking good, and then literally overnight we had 5 admissions to our hospital, and we prepared for it. We saw it coming from a nation, and then from a state, and then you could see it closing in on Talladega County and in Sylacauga and the surrounding cities. So overnight we had those 5 admissions. We already had plans in place to open our COVID floor. And we ended up July with a 13% positivity rate, which was not as bad as the 27% we saw last July,
yes.
but it was a big difference between 5% and 13%.
Yes.
And the way we do our positivity rate, we take the total number of COVID tests that we do and then divide them by the number of positives and times 100%. So that's how we get the positivity rate. Some people have asked how we get that, but that's how we calculate that.
And that's an everyday thing.
Yes, ma'am. Yes, ma'am. I'm up at home, and I look at our census and look at our lab data. Fortunately, I'm able to do that at home.
Good.
So I spend about an hour at home before even getting to work, and then we report to the state our numbers. So we have to have those numbers in by noon every day. I get them in early. They're wanting to know how many patients are in our hospital, how many are positive, how many are under investigation, how many in the ICU, how many on ventilators. So we put all that information in every single morning, and have been for I guess 14, 15 months now.
Goodness.
So it's been a
blur. I can't imagine for y'all what it's been.
Absolutely.
How do I know when to go get tested? Because I have a cough or fever or what?
Yeah, that's a great question, because there's lots of things that can mimic the symptoms of COVID. Cough, sneezing, fever, all of those things can be COVID related. So the question is, have you been around someone that's got COVID? Do you know someone that's positive? And are you at increased risk for a bad outcome? Do you have a chronic condition like COPD, heart failure, diabetes? Are you overweight? All of those things kind of add to the seriousness of the disease. So if you have those symptoms and are becoming increasingly short of breath, that's when you use the emergency room. Our emergency room is not necessarily for diagnostic purposes to get that test, but if you have increased shortness of breath, really hard to breathe, you're just feeling just terrible, that's when we use our emergency room.
Okay. Yeah. What about if I know I've been exposed? I know it seems like months ago we learned so much about quarantine, when to quarantine, how many days. How is that now?
So if you've been exposed and you are vaccinated, you don't necessarily have to quarantine. But if you've been exposed and you've not been vaccinated, then you need to remove yourself from the public for 10 days. And I will say, talk about the people that are working, your work should dictate how that quarantine, because different companies have different ways of quarantining. They have different protocols in place. So if you're in the workforce, then I would suggest you contact your human resource department and make sure that's what they're doing. So that's very important.
That's true. Every agency has their own guidelines.
Yes, ma'am.
It's so nice that people can work from home now.
Yes,
I think that's part of the new normal, I guess, too. We talked about the hand sanitizing. We have one at the library, or some at the library, and I try and use those if I go somewhere, thinking about prevention, into the grocery store or wherever I'm going. So when I come in here, if I touch things, my hands are clean.
Absolutely.
Wearing masks, all of that is kind of our new normal.
Yes, ma'am.
Don't know that we'll ever change. Where can I go to find the latest information about COVID? Is there there's a lot out there if you Google that.
There is a lot of information out there. My main source is the CDC. Here's the thing with the CDC, they're concerned with the nation. What I'm concerned with is the people in our hospital at Coosa Valley. Right. That's what I'm concerned with, and the people that are taking care of the people at Coosa Valley Medical Center. So I use that information from the CDC and I try to melt it down as local as possible. That's when we talk about the Delta variant. It's important to know that we have the Delta because it's more contagious and the people are sicker. But the CDC is one of the top websites. It's very searchable, very easy to use. The frequently asked questions is a good place to start. All of those things. And anytime you go to a website, there's a healthcare certification, and it's usually at the bottom of a page, and it's a red, white, and blue banner. Okay. And when you see that banner, you know that information has been peer reviewed and that it is reliable information. So you have to be careful Googling all this stuff because there's a lot of people out there with a lot of strange ideas, and it's not necessarily peer reviewed or not necessarily accurate. So look for that healthcare certification on the web page.
I'm glad to know that. Well, thank you so much for being here.
Yes,
and just before we close, I know the hospital is giving vaccines Wednesdays.
Yes, ma'am.
From what time?
8:30 till noon.
Noon.
Yes,
okay.
ma'am.
Just walk in, no appointment needed. Thank you for being with me, Jeff, and thank you for joining us on Library Connection.